Many symptoms of aging are a direct or indirect result of diminishing GH and testosterone levels, including low energy and fatigue. Without HGH therapy, GH levels continue to decline, referred to as somatopause. By 30, most people are GH-deficient, which can result in somatotropin deficiency syndrome, SDS. Somatotropin is another name for GH. The symptoms of the somatopause include low energy and fatigue, increased body fat, loss of muscle mass, decreased physical mobility, a reduced ability to heal, an increased risk of cardiovascular disease, lower life expectancy, wrinkles, osteoporosis, gray hair. Sexual dysfunction evidence suggests that HGH replacement therapy can dramatically reduce the symptoms of somatopause. HGH can assist in reclaiming your youth and vitality. It plays an essential role in the immune response. As testosterone levels decline, it causes sleep disruption, so your body does not recuperate from the day properly, and it can exacerbate because endogenous testosterone production increases during sleep. Contact us at aclinics.com or check our channel for more info.
AI Clinics, no excuses, just results. Give us a call for a free consultation with one of our clinical advisors.